Hey everybody, welcome back. In this video, I want to tell you a little bit about the type of breast cancer that I have and explain why it's a little bit different from most cancers and stuff like that. So let's do it.
So pretty out tonight.
Okay, so like I said in this video, I'm going to talk to you about the kind of breast cancer that I have, and I will tell you why that is important in a minute. But first of all, I just want to say that in general, there are two main types of breast cancer. There are actually many types. I think I've heard even over 100 different types of breast cancer. I had no idea before I was diagnosed, but there are two most common types. So the first most common type of breast cancer is called invasive ductal carcinoma. That is by far and above the most common type of breast cancer. It accounts for, most people say, like between 70 and 75% of all cases of breast cancer. So it's easily the most common type. The next most common type is called invasive lobular carcinoma, and that type only accounts for about 10, maybe as much as 15% of all cases of breast cancer. So it is obviously way fewer than invasive ductal carcinoma. Because there are so many cases of breast cancer, invasive lobular carcinoma is actually still more common than ovarian cancer and a lot of other kinds of cancers. But because it's such a small percentage of breast cancer, it's still like there is not a lot of research that's gone into it and not a lot of funding. So there's still a lot that isn't known about invasive lobular carcinoma, and even a lot of doctors don't even really know a whole lot about it. So there's just still a lot of unknown with it, but that's the one I have. I have invasive lobular carcinoma, and it actually acts differently from a lot of other cancers. So, that affects treatment and stuff like that. So, invasive lobular carcinoma is often being described as sneaky. It's often like on a lot of the websites that explain about it and stuff like that. It's called sneaky because it doesn't form tumors like almost all other cancers that you hear about. It's missing something that causes this cancer cells to clump together, and that's called E-cadherin or something like that. So because they don't clump together and form tumors, they just continue, cancer cells just replicate at an unusually fast pace. So when they do that, they tend to form a line of cells, and that becomes like a thread, very small thread of cancer cells. So that acts differently. Like you can't feel it. Like a lot of ladies with invasive ductal carcinoma, they can feel a little tiny lump, even they talk about the stereotypical frozen pea or something, or sometimes it's like the size of the eraser off the tip of a pencil or something that is just small, but they can still feel it because it forms a lump in there, makes a little tumor. But invasive lobular carcinoma doesn't do that. It doesn't form a little lump like that. It is forming threads inside. So as you can imagine, if you had a thread even just inside your clothing, you can't really feel that. But the size of cells and inside your body, it's soft, and when you touch it, there's nothing really that you can feel. So not until way far later in its growth process, when it forms so many threads that they kind of crisscross, all over each other, and, eventually kind of form some kind of a mass or something like that. So that's the one thing, is that you can't feel it right away, not for a long time. So invasive lobular carcinoma cases tend to be more advanced by the time that they are discovered. And then the second thing is, because they are just either, scattered cells or a thread, they also don't show up on scans very well. So again, often not until they're way more advanced. So if you saw my other video that I posted the other day about how I discovered that I had breast cancer, I mentioned that I had a mammogram 5 months, only 5 months, you guys, before I was actually diagnosed with with stage 2 breast cancer. It was already stage 2 even then, and just was missed. They just couldn't see it. And I was symptomatic. I was complaining of pain, and but even then they still didn't see it. So yeah, those are the things about it. It's a little bit sneaky, and it just acts differently. The dangerous part about it also is that, even if it metastasizes and shows up somewhere else in the body, it's still the same cancer. It's still the same genetic makeup. So it's equally hard to find. And breast cancer tends to metastasize first in the brain, the lungs, and the bones. Those are the 3 most common places that breast cancer tends to metastasize. And even if it goes to those places, it's still pretty hard to find, at least for a while. So my doctor told me, even though I had a clear PET scan a couple of months ago, it doesn't necessarily mean with invasive lobular carcinoma that it's not there. It just means we can't see it. So that's not real reassuring, but anyway, that's just how it is. That's what it is, and that's what I have. I have invasive lobular carcinoma, stage 2, and if you know about the grading system of the cancer cells, there's it's different from the stage. It's more focused on the cells and how changed they are from a normal cell. So there's a scale of 1 to 3 for cancer grading for the cancer cells, and 1 being pretty close to a normal cell, and 3 being the most changed from a normal cell and probably the most aggressive, and mine was a 2, so right in the middle. And my doctor told me that it's an intermediate score on that one. So I had a high proliferation marker, which would tend to make us think that it's growing fast, and I personally could tell that it was growing fast. At least that was what I felt like I was experiencing. So this is what came back from my pathology report, and it was widely invasive, and it did have vascular involvement, and I had a 4-centimeter tumor, which my doctor kept saying, because your tumor is relatively large, or because the tumor was pretty big. So it was a pretty big tumor, and I don't know for sure all of what is going to be involved in my treatment, but it looks right now like chemotherapy is going to be in my future, probably very soon, and then probably that's going to be followed by radiation with extra boost radiation, and then that will be followed by 5 to 10 years of hormone treatments. So it feels like I still have a mountain ahead. It's just crazy because I don't feel sick. I don't feel like someone who's sick. And, right now I'm feeling so well, and it's just surreal and crazy and hard to believe that I'm going to probably be starting chemotherapy in a couple weeks or whenever. My doctor's still trying to give me time to finish healing before we move on to the next stage of treatment. So like I keep telling everybody, I feel like we've been given a very sweet calm these last couple of weeks in between storms. So surgery was really rough. It was hard. Recovery has been long and painful and hard, but I'm getting over the hump of that. I'm feeling really well, and I know that I have a lot ahead of me. So for those of you that know anything about chemotherapy, yeah, that's probably not going to be an easy thing to go through. And my doctor told me that I would lose my hair. So that's a whole nother thing, but you know, it's okay. We'll get through it. We'll get through it. Gotta do it. If I do all the things, then I actually end up with a pretty good prognosis. So it's definitely worth it. So anyway, that's that. Thank you guys for watching. Thank you for continuing to pray for us and love us through this process. We just love you all so much too, and appreciate you, and thank you. So that's it. See you next time.